Abu-Sittah, as I mentioned a moment ago, British-Palestinian surgeon, rector of the University of Glasgow, has been providing medical assistance as a surgeon to many crises, many conflict areas, Iraq, Lebanon, Syria, Yemen, Gaza, where he's been back and forth working in hospitals over the decades, including MSF up until 2023, and left Gaza through the Rafah crossing. Ghassan, it's great to talk to you this evening. Thank you for your time. First, let's start with MSF.
Thank you for the invitation.
You're welcome. It's great to have you. The work being terminated, what vacuum does that leave?
It's absolutely devastating. I mean, the aim of this intentional Israeli policy is to continue the strategy of the war, of the genocide, in destroying and dismantling the health system inside Gaza as a way of making Gaza uninhabitable. The idea is that more than ever, the Palestinian health system depends on the humanitarian sector. More than ever, patients depend on hospitals run and services run by the humanitarian sector. And so intentionally shutting down what is probably around 30% of the health system that's already on its knees and that has not been in any way rebuilt or re-equipped during the ceasefire means that more patients will die. Patients will be denied access to healthcare.
When you actually look at on the ground work, you talk about 30%. I think also it's around 20% of staff and help within the hospitals across Gaza as well. So there's a huge chunk just suddenly disappearing. We're talking about 1,500 staff. Israel maintaining that some MS staff, they claim, have links with Hamas and Islamic Jihad, hasn't provided evidence. The point from Israel's government is that other charities have complied. I mean, do you think the group is right to hold back the information?
So let's look at the last 2 years. Israel has killed 1,700 health workers, doctors, nurses, and technicians. It's also killed 563 aid workers, of whom 15 were MSF staff, doctors and health professionals. And so the idea of handing over people's personal details to the Israelis is asking for them to go on the same assassination list that their colleagues had gone on before. We add to this the idea that we know from UN reports prior to October 2023, Israeli security officials used to try to blackmail Palestinian patients trying to leave for treatment outside. And so allowing Israelis to the Palestinian staff so that they can be threatened with having their names put on an Israeli blacklist if they don't comply with the request of the Israeli security officials is asking for trouble. Israel has no business asking for that kind of data. Two, what the Israelis know and completely ignore is that MSF, as a European institution, is bound by European law here to safeguard the safety of its employees, even if these employees are not based in Europe. And so that request contravenes EU law. It also contravenes EU data protection law, which bans or prevents giving access to databases in a way that endangers those who are on the databases. Mm-hmm. Israel does not care about European law as much as it does not care about international law. What it wants is to keep Gaza uninhabitable.
Can I ask you about those who are living there at the moment? The last time you were there, I think there were some extraordinarily traumatic times. The Al-Aqli Hospital explosions there, 2023. From what you witnessed, from what you're hearing now, from contacts that are still there, the changes to life in the ceasefire, what's the transformation like? You know, we were hearing every day of close to famine, that those bowls we would see handed out people for basics of rice, the looting. How is that changing?
So Israel intentionally prevented any kind of shelter material from entering into Gaza. So what we've witnessed is that between the malnutrition and the starvation, cold weather in the winter, we have been having cases of death due to hypothermia in children. Children remain malnourished because the amount of aid allowed in is minimal. The health system has not been rebuilt or supplied in any way. And over 90% of all requests by medical teams, not just from MSF, from all of the humanitarian sector, are being rejected. And so not only is the health system not been rebuilt, there is no access for the Palestinian health system to expertise from outside to help share the load. And so what we've had is over 1,000 of the wounded children on the evacuation lists have died since the ceasefire, waiting to be allowed out of Gaza. And this trickle opening of the Rafah crossing is not going to address over 6,000 wounded who now need urgently to be taken out for treatment.
Yes. No, we were talking, we heard from Tess Ingram at UNICEF, who's just back from 4 months in Gaza. She raised some of those issues you talk about, but said actually that famine, those conditions have eased a lot. People are not having to beg for food. The looting's largely stopped. The figures you mentioned too is worth reiterating. The IDF claiming Hamas continue to violate the agreement. It's, as you say, not stopped the strikes happening. More than 500 civilians killed in 3 months. More than 100 of them, as you say, children. More than 30 people just yesterday. The other thing I want to raise with you is the Rafah crossing, because to a lot of people listening about this opening, it's an abstract, because reporters can't go there, international correspondents can't report from it to explain what it's been like living, breathing, the desperation to get out. You've experienced it, you got out that way. How significant is this partial reopening tomorrow?
If the numbers that are being banded, which is up to a maximum of 150 being allowed each day, this will not address the humanitarian catastrophe facing the wounded who are waiting to be evacuated from Gaza. Plus, one of the most disturbing things about what the Israelis are saying is that for every Gazan allowed back into Gaza, 3 have to leave. And so the Israelis are predicating the continuation of ethnic cleansing on the opening of the Rafah border. So more Palestinians have to leave Gaza than can be allowed back into Gaza. And